Hello everyone and welcome to OPG Hub. I'm so excited to see you once again. Now, do you know there are some stuff you're not supposed to do in the hospital, the health center or any health facility? Yes, they are. So in today's video, I'm going to show you 10 things you're not supposed to do in the hospital. Are you ready? Let's dive into it. Number 1, don't lie to your healthcare provider. It is very important that you tell the whole truth to your healthcare provider, not some truth. Not part of the truth, not bit of the truth, but the whole truth. Now, if I say 99% truth and I say 1% lie, it's still 100% lie. And the healthcare providers depends on the information you tell them. So you're not supposed to lie about your symptoms, because once you lie about your symptoms, it gives a false and misleading information for your diagnosis and your treatment. Number 2, don't insult, disrespect, or yell at any healthcare provider.
All right. Okay. All right.
It is very important for you to know that most of these healthcare providers are baffled by pressures every day, from making decisions about life and death, responsibility of other patients, and also from long shifts. And so that alone also tolls on their mental health. So if you find anything that the healthcare provider is doing that you don't like, politely and gently approach the person and speak to him or her and let your concerns be known, and I'm sure he's going to listen to you. Number 3, don't get upset with your discharge. Now, discharge means patient can continue healing outside the hospital. There are a lot of factors that will eventually cause someone to be delayed or being discharged to be delayed. Few of this could be: 1, patient is not stable. Maybe the vital signs like the BP, the blood sugar, and a whole lot are indicating that the patient is not stable and cannot do better outside the hospital. So he will need to be detained. Also, when the pending lab results are not yet ready, lab results actually helps in the diagnosing and the treatment of our patients. So if the lab reports are not ready, that will also cause a delay in the discharge. In case where patient needs to stay in the hospital to take a full dose of some medication like antibiotics or some wound treatment, it requires that the patient stay in the hospital, and that can cause the delay in the discharge. So you should know that this is in the best of the interest of the patient. At any point in time, if you feel worried and upset about the discharge, kindly approach the healthcare provider and know and ask the reason why the discharge has delayed, and I'm sure they will give you very adequate reasons. Number 4, never leave against medical advice. It's very important. Now, the medical advice actually is being given by the healthcare providers to tell you how your health condition is going. I know of people who says their pastor says they should leave the hospital now and they want to go out of the hospital. That is not good. What actually happens is that it distorts your treatment, it distorts and even worsen your health condition. So our advice that if the doctor says something that you are not so comfortable with, and because of that you want to leave the hospital as soon as possible for other alternates, kindly voice out, make your concern known to. Number 5, don't fear the injection. I mean Dr. Panier. Dr. Bo, no be anywhere. Dr. Bo, no be anywhere. Dr. Yene Panier, dear, no be anywhere. Dr. Yene Panier, dear, ne mount anywhere. Tell me, say me yo. Tell me, na me yo. Tell me, tea me yo. I know a lot of, when it comes to injections, a lot of you have drama. You and the doctor will be having drama in the hospital. Just take note of it. That injection takes just a few seconds, and that tiny pinch is a big protection for you. And so you should know that injection is your body's friend and not an enemy. And so why should you be afraid of injection? So anytime you are called to receive injection, be it at your shoulder or your bum, guys, just go and receive it. Number 6, don't adjust any medical device. It's very important. At this point, I want to let you know, those of you, let me warn you guys, those of you who have been adjusting the drip in a way that you want the drip to finish quickly so you can run away from the hospital, stop. It's not good. Those of you also have no idea about how to use the monitor, the defibrillators, the dialysis machine, and you want to just adjust it because you have seen that something is going wrong. No. What you are supposed to rather do is call for help. If you notice that things are not going on well, just quickly call for help. Don't adjust any medical device. Number 7, don't ignore visiting hours. Now, visiting hours are actually times where relatives meet their patients or their loved ones and give them that emotional support that they need, and also to see how best they are doing, they are faring in course of their treatment. Visiting hours is also very important, where the patients see their relatives and have that assurance that somebody is with them throughout this difficult time. Patients need adequate rest to recover from their disease in the form of treatment, whereas staffs or the healthcare professionals also need uninterrupted space to carry out their duties. So their visiting hours actually help the doctors and the patient to have all this time to themselves. Now, in that visiting hours, usually hospitals have morning visiting hours and evening visiting hours. It's brief and short because we want our visitors that comes to also not contact any infection back home, so they can also be safe. Then again, in those visiting hours, what we require of you is just quickly meet your relative, reassure the person, see how best they are doing, and take it briefly and go. Number 8, don't throw waste in the wrong bin. This is very important. Usually when you go to the hospitals, you see that there are different colors of bins: red, black, yellow, and we have some sharp box also. Take note of it. They are not just for designs, they are very important. When you have the black bin, usually if you find a hospital where they don't have the black bin, they have the black rubber instead, so take note of that. So the black bin is general waste, where you can put your paper, your leftover foods, your bottles and other stuff in that bin. With the yellow bins, which is infectious waste, that is where they put cottons, use gloves, and use nose masks in it. And usually, because they have come in contact with bodily fluids, it is very infectious. Then we have the small box, which is made of a cardboard, usually sometimes yellow. It's where we put sharps, we put strings, we put lancets and all those stuff in, and it's also very hazardous. Throwing waste in the wrong bin will cause infection to the patient, to yourself, to the hospital staff, and to the waste handlers. Also, when you put sharps in waste bins like the general waste or the infectious stuff, the waste handlers, those who come and collect the waste, can get pricked, hurt, and then they are prone at getting HIV or hepatitis, and that is not what we expect from that. So we ensure that anytime you walk in and out of the hospital, you put the waste in the right bins, and I hope you are going to do that. Number 9, don't skip hand washing. Now, germs are everywhere at the hospital, and the hospital staffs also try as much as possible to reduce this by doing regular disinfestation and cleaning up. However, it's also very important that you need to wash your hands anytime you go in and out of the hospital. This simple act makes a big difference. Take note that you need to wash your hands before you enter the hospital and after you leave the hospital, before and after touching a patient. This simple hand washing can really save you from life-threatening diseases. Number 10, don't sit or lean on the hospital beds. Now, the hospital beds are only for the patient. I know usually relatives and friends who visit their patients at the hospital want to show love by trying to sit on the same hospital beds, trying to, create that emotional support. But that is not good. You are actually carrying germs from you to them, or vice versa. So it's very advisable you don't sit on the hospital beds or lean on the hospital beds. You can also cause damage, or you can also cause some of the medical equipment to be slightly disaligned, and that can lead to a lot of complications. So I advise that rather use the chairs that are provided, sit in the chairs, and even as you talk to your patient. I hope you are going to do that. So you could see that these 10 things I've mentioned are very basic you can do. Doing these 10 things at the hospital can go a long way to save yourself, your patient, and the healthcare providers, and for all of us to live healthy and stay strong. And that is all what we are looking for in the hospital. And I know you have enjoyed this video from the very beginning to now. Don't forget to kindly subscribe if you have not yet subscribed. Hit the notification bell to always get updated anytime I post my amazing content. And then also drop your comments in the comment section. And Very importantly, share this video for everyone to know and to watch and see, so we all learn from this. Until then, see you.